I want you to treat substance use disorder and alcohol use disorder like other diseases. It's common for people, even within the recovery community, to characterize SUD, AUD as a spiritual malady, a lifestyle choice, or even self centeredness. However, this perspective dismisses the biopsychosocial complexities of these disorders and often perpetuates shame instead of healing. Why do people resist holistic interventions for these disorders? There's a persistent resistance to understanding SUD and AUD from a medical standpoint. Evidence based treatments, which include prescription medications, specialized teams, and habits that promote mental and physical health, are often overlooked in favor of punitive or overly simplistic approaches. I once worked with a client in residential treatment who resisted family visitation because they feared their family would see their attendance as summer camp for adults. The myth underlying this client's fear that recovery must be grueling or involve suffering to be valid reflects a corrosive mindset. My signature program, the Thrive Framework, directly challenges this narrative by promoting transformative, health focused habits that foster long term success. Hey, it's Dr. Joe. If this message resonates with you, let's connect. Don't forget to follow me or subscribe for more insights and like this video to support this important conversation. I'd love to hear your thoughts. So drop a comment below and to share your perspective. For those ready to take their recovery to the next level, my executive sober coaching program provides personalized strategies to help you thrive without alcohol. Visit Sober in the C Suite to learn more and start your journey today. There are biopsychosocial parallels to other diseases in SUD, AUD, like cancer, heart disease, diabetes, and multiple sclerosis. They are biopsychosocial disorders requiring comprehensive care. Let's explore how mainstream medicine approaches these conditions and draw parallels to SUD recovery. So, from the MD Anderson Cancer website, the causes of cancer are interaction of genetic, environmental, and constitutional factors. Treatment includes screening, custom treatment plans, prescriptions, exercise, stress management, and mind body practices like yoga and music therapy. The key insight here is that holistic care includes addressing emotional tolls through CBT, acceptance and commitment therapy, and resilience building. The connection to the Thrive framework is just as music therapy and yoga reduce stress for cancer patients, Thrive promotes accessible, tailored strategies like mindfulness and intentional hobbies to enhance emotional resilience and recovery. Heart disease from the American Heart Association. Causes of heart disease include a genetic predisposition, lifestyle factors, and habits like smoking or alcohol use. Treatment includes lifestyle changes, medication, stress management, and mindfulness. The key insight here is that heart disease management emphasizes addressing co occurring mental health challenges, such as depression, which is very common after heart events. The Thrive Connection is recovery strategies under Thrive include stress reduction techniques, gratitude practices, and intentional boundary setting to prevent return to use and cultivate well-being. Diabetes from the American Diabetes Association. Causes of diabetes are genetics, lifestyle choices, and environmental factors. Treatment includes weight management, physical activity, and emotional support. The key insight is emotional inventory and mental health support are integral. The Thrive Connection is Thrive underscores the importance of emotional health and sobriety by integrating practices like reflective journaling and guided meditation into your recovery plan. So, multiple sclerosis from the National MS Society. Causes are still being researched, but genetic and environmental triggers play a part. Treatment includes healthy behaviors, stress management, gratitude, and cognitive stimulation, such as learning new skills or languages. The key insight here is managing stress can alleviate symptoms and improve cognitive health. The connection to the Thrive framework is like MS treatments, Thrive prioritizes mental and cognitive wellness by encouraging creativity, lifelong learning, and balanced routines. Let's talk about relapse. Let's talk about it honestly and address relapse with compassion. All these diseases share one critical factor: they involve a risk of recurrence. Yet, while relapse in conditions like diabetes or heart disease is approached with compassion and a strategic plan, relapse in SUD, AUD often attracts stigma and shame. This stigma discourages individuals from seeking help and reinforces the cycles of guilt. Thrive reframes relapse as a learning opportunity, focusing on recovery capital, the internal and external resources that sustain long term sobriety. By normalizing support and mitigating shame, we create space for sustainable healing. There is a cost of the stigma of SUD and AUD. Resistance to reframing them as a medical condition harms individuals, families, communities, and employers. It delays treatment and reinforces the false notion that shame or suffering is a prerequisite for recovery. Thrive offers an alternative, a proactive, empowering framework that dismantles these myths. It integrates qualified care, positive habit formation, and resilience building into a comprehensive, human centered approach to recovery. Recovery isn't about punishment, it's about transformation. If you are still with me, I invite you to the following reflection. Everyone deserves access to holistic, qualified SUD and AUD treatment. Reflect on how your mindset might perpetuate stigma and prevent healing. At Sober in the C Suite, the Thrive framework invites you to embrace a recovery paradigm rooted in dignity, science, and hope.